everyone, welcome to another episode of Vlogmas. For today's episode, I'll be featuring another YouTuber from the medical field. His name is Dr. David Hindin. David is a fourth-year surgical resident, and if you check out his YouTube channel, you can really tell that he puts just as much into his YouTube videos as he does into his work. His videos are really awesome. So without further ado, let's take a look at his typical day as a surgical resident.
Hey guys, my name's David. I am a YouTuber and a fourth-year surgery resident. And I hope that you get a good night's sleep tonight because tomorrow morning I'm going to take you with me on a day at the hospital.
So my days start right around 5 a.m. on most days. And if I'm being honest, I usually hit the snooze button a couple times. If I'm doing really well, I'll have some time to make a little coffee. But if not, I'll just grab it on the way to work. Now, my morning commute depends on where I am. So right now, I'm actually on a rotation at an outside hospital to do some community surgery. We kind of refer to it as the bread and butter general surgery cases that we do during residency. So in the morning, when I get to the hospital, I typically drop my bags off first.
So this is the back area where our on-call room is. It's kind of in a random hallway. This is, we call it an on-call room, but the doctor's quarters. These are extra supplies if you're so lucky as to have time to sleep. So this is my on-call room. Let's see, on top of here, there's a bunch of random stuff, and that's because we kind of like accumulate supplies that are hard to find around the hospital and then leave them here so they're not hard to find, especially if there's an emergency. So this is a chest tube, and this is what goes in your chest if you have a collapsed lung or someone's been stabbed and they have blood in their chest and we have to get it out quickly. A bunch of random supplies in here. I've got a little stethoscope here, and these are my loops. Loops are a kind of special magnifying glasses that some surgeons wear depending what kind of surgery you're doing. So anything where you're working with really fine details, let's say you're sewing together two blood vessels, you'll want to wear these because this magnifies the work that you're doing. Always.
Every day, it's something a little bit different in the OR. And the day that I filmed this, we happened to be doing a robotic surgery. Robotic surgery basically just means that you are using another tool to operate with. So as you'll see here in the video, there is the robot over the patient and you see the moving arms, but we actually control this from a console that's in the room. So you can see what it looks like from the outside when someone's using their hands. And here's what it looks like when you actually sit down in front of the console. And here's what it looks like on the inside of the console. It's hard to really translate to the video here, but it's essentially a fully immersive, three-dimensional experience as you're sitting at the console. So it's pretty cool to operate with, and it's actually almost easier than operating normally. And then after surgery, we take our patients to the recovery unit where they wake up from anesthesia and the nurses make sure that they're safe to leave the hospital and go back home. Or it's where they recover before they get admitted to a floor.
So guys, thanks so much for hanging out. I had a ton of fun sharing this bit of my life with you. And if you'd like to see more, make sure to come check out my YouTube channel. And finally, a special thanks to Jamie for sharing this with her audience. Jamie, it's been a blast working with you.